Dear friends, dear ladies and gentlemen, it is with great joy that I welcome you to today's session with Dr. Atul Jaggi, a case of an adolescent with panics treated with classical homeopathy. This session is being recorded and will be available in YouTube. I'm Dr. Lefteris Tapakis. I'm a medical doctor practicing classical homeopathy in Greece. I'm a diploma holder of International Academy of Classical Homeopathy, and I'm the coordinator of Vithoulkas Compass. Now, a few words about our speaker, Dr. Atul Jaggi. Dr. Atul Jaggi is a diploma holder of International Academy of Classical Homeopathy, but also a teacher of the Academy. He's one of the modulators of the Vithoulkas e-learning course, the full course of homeopathy by International Academy of Classical Homeopathy that contains theory, materia medica, cases, and other material taught by the unparalleled way by our professor, George Vithoulkas. For more information about the learning, please visit www.vithoulkas.edu.gr. Dr. Atul practices classical homeopathy in Western India in the city of Nashik, not far from Mumbai. And the name of his clinic is H3, meaning Health and Happiness by Homeopathy. Please write your questions and answers, during the session, in the chat session, and we will try to answer them in the end. Andreas Tsokanas, after the Q&As, will tell you about an offer we have. So without further ado, I pass the microphone to my colleague, Dr. Atul Jaggi. Doctor, please, dear Atul, the microphone, the stage is yours.
Thank you, Lefteri. Now, hello, dear friends. Before I present the case, I want to say that we hold these sessions specially to show the importance of Compass as a repertorization program in our practice. And I must also tell you that the importance of e-learning and Professor Vithoulkas' teachings is also the reason why I am here to show you the success in difficult cases. So I cannot thank e-learning enough because it helps us to understand how to solve deeper cases, deeper chronic problems. Now, talking about this case, friends, this case is special because of two reasons. One, because of the intensity of the suffering of the patient, and because of which the parents were suffering severely, seeing their daughter in this condition. And the second more important reason why I chose this case is that the software will give us the remedies provided, and it is dependent upon the information which we enter into the software. So this is a big discussion, that what information are we entering, and then we will get the correct results. So with this background, please allow me to share my screen. Okay. So a female who was suffering with severe panics, young female, the first consultation was on 11th April this year, 2023. Her presenting complaints, she said that since 2017, which is roughly 6 years, she has been having periodical panics, but the frequency and intensity have increased in the last 1 year, that is since 2022. Lefteri, can you hear me? Am I audible or there's a problem?
Yes, very well. You are audible.
Okay, okay. Thank you, Lefteri. So she had a severe panic in February 2023, which frightened even her parents because of the intensity of the panic. And since then, she was put on allopathic drugs, which were 4 in number, and it included an anxiolytic, an antidepressant, and even an antipsychotic drug. So when she came to us in April, she was already taking 4 such drugs. Now, in spite of that, I will describe to you how she was. So the panic, the picture of the panic, which was 3 times underlined, she would hyperventilate. These panics would generally come after sunset. In this panic, she did not want to go to the hospital. Rather, she would hide under a table, underline 3 times, or hide herself under a blanket if there was no table there. And another peculiar thing was that during panic, she would scratch and dig her nails into her skin to the point of bleeding. So this she would do whenever she would get into this state. And the fears that she had overall, that someone was after her, underline 3 times. Fear of men, underline 2 times. Fear of rape, underline 2 times. Fear of death, 2 times. Fear of dark, again 2 times. And fear of going into public places or crowds,
Da.
which was again underlined 2 times. When I was taking the whole history, I came to know that in December 2021, she was at a crowded place and she was manhandled there, and this had disturbed her. She remembered this very vividly. So with this presenting complaints, when we took the whole case, the other mental symptoms that we found, there was great sadness, underlined 3 times. And I write here in quotes, she said, "No one likes me. I am a burden on everyone." So she had these feelings of being a burden and feeling very sad. Her mother told me that in the past she was a person who would desire affection and hugs, but now she does not socialize at all, especially in the last year. She had suicidal thoughts, underlined 2 times. Mood swings were very strong, confirmed by her mother also 3 times. She was very indecisive and irresolute, underlined 3 times, could not take decisions in her studies, in her day-to-day life. Another strong symptom or feature which we found in her, that she loves animals, underlined 3 times. She would feed all the stray dogs and spend hours with them. And another special element for her was in her nature, she liked watching horror movies, movies on vampires and evil spirits. So, this was the mental totality of the mental symptoms that we found. Now, coming to the physical generals, she was thermally a hot person, underlined 3 times. She was heavy in her weight, so I took obesity 3 plus. And she had a tendency to overeat and then feel guilty after eating. Aversion, slimy, underlined 2 times. Desire, spices, underlined 2 times. And fat of meat, 1. Her sleep position was on her abdomen, mostly 2 times. She would get frightening dreams which would not wake her up, but the dreams were frightful. And a pattern was that in her dreams, she was getting hurt or injured. So, dreams of injury, underlined 2 times. Her periods, she told me that she gets premenstrual syndrome where she is VP before menses, underlined 2 times, and also cramps in her abdomen before and during menses, 2 times. And she could drink milk. She had no aversion to the milk. So these were the physical generals that we could get from her. So I will present to you now the totality of the case because we will study it together. So I also write causation fright, considering the fact that she was manhandled. And I write a question mark because she said it definitely affected her, but panics existed even before. So now I would like you to share your thoughts that how you would like to start in this case. I know it's a difficult case. Nobody is. Anacardium. Anacardium.
Pulsatilla.
Pulsatilla. Yes. Stramonium.
Barita, carbonica, aconitum, belladonna,
Yeah.
mentorinum.
I want you to think Athusa. Athusa, you see, this is why I specifically wrote that she desires milk. she can drink milk. Athusa has an aversion to milk. So, and Athusa does, you see, in Athusa, there is a fear of examination. There is a fear to close their eyes before sleeping. But we don't see this fear in Athusa. So, Pulsatilla, Calcarea carb. Yes, correct. And Pulsatilla. And is so I was also thinking of Pulsatilla because she is hot, but the problem is she can take meat. She likes meat. She sleeps on her abdomen, which Pulsatilla does. Mood swings is a Pulsatilla symptom. Love for animals is also a Pulsatilla symptom. But you see, Pulsatilla would not have a tendency to harm herself, digging nails into the skin, suicidal thoughts. This doesn't go with Pulsatilla. So, Stramonium, I will go one by one. Stramonium can have panics, but we would like to see strong fear of dark and tremendous nightmares. They would scream in their sleep and get up, as Professor Vithoulkas describes, looking through and through you because they are so much frightened, which we did not find in this case. Then comes, as people are saying, aconite. Of course, fear of death, panics, hyperventilation, worse in the evening. This is an aconite picture. But aconite, the death fear would be much more than this, and they would like to go to the hospital. So somebody asks, is she in constant panic state? No, they would come in waves, which is again aconitum. There were some fears that were constantly there. For example, fear of men, pursued, rape, which she would feel in a chronic state, but panics would come periodically. Somebody says argentum nitricum. Okay, so let me go. Let me take you to the.
Please mute your microphones. Yes.
Thank you, Lefteris. Okay. So let me take you to the compass and let us study the case together. Okay. So Lefteri, can you see the? Okay.
Yes. Yes.
So let me share the symptoms which I took. Anguish, which is a severe state of panic, and I combined it with fear, sudden panic attacks. So of course, aconitum is in 4+, and we find arsenicum, stramonium, nitric acid, and so also anguish. I combined these two rubrics.
So can you zoom in a little bit so to
Sure.
Great. Mm-hmm.
Okay, I will also make it in 2-pane.
Mm-hmm.
Okay. So the next symptom which I took it in 3+, was a desire to hide on account of fear, where we have arsenicum, where we have belladonna and cuprum. Now this in belladonna is, you see, if we look at the rubric, delusions horrible on closing eyes and seeing horrifying things and desire to escape. This is a complete picture of a belladonna panic. They want to climb the walls, because they are so frightened and they are seeing horrible things if they close their eyes, which was missing in this case. But she wanted definitely to hide. Then I combined two other rubrics: ailments from fright and anxiety after fright. I combined these two. Of course, there are many remedies in ailments from fright. Fear someone is behind him. Actually, she wanted to say that she has fear that there is somebody is following her, which is Medurinum. Somebody is after her, actually, pursuing her. Then the next symptom which I took is mood changeable in 3 times, which is, of course, Pulsatilla ignatia. Irresolution 3 times. Warm aggravates because she is hot thermally 3 times. Obesity 3 times. Fear of men, Lycopodium, natrum carb, and Pulsatilla, we know. Fear in the evening after sunset, which is again Pulsatilla. Fear of dark, which is again a big rubric, having Stramonium as a strong remedy. Fear of impending death. Fear of crowd, I took it in 2. Reproaches himself, suicidal thoughts. Now, this is interesting. Somebody asked me to show this symptom. Mutilating his or her body, self-harm. We find Arsenicum album, Curare, Mancinella, and Medurinum. Then I took aversion to company, which is a recent change. Dreams frightful and dreams of injuries. She's getting injured. Here we have all 6 remedies in 1+. Phosphorus is one which can have strong anxiety and panics. Next, weeping before menses, abdomen pain before and during menses, aversion slimy, desire spicy, sleep on abdomen, and desire fat. So in total, in this repertorization, there are 26 symptoms. And let me share the results. Which do you think will be the first remedy? Let us see. So VC says you must think of aconitum, which we were definitely thinking, because aconite has periodical panics, worse in the evening. But for aconitum, the fear of death should be 4+. This was not so strong here. That was the question mark for aconitum. Then Pulsatilla we have discussed. Medurinum, especially because of fear that someone behind her. Fear of dark. But it does not, let me show you. It does not have desire to hide, fear of men, fear in the evening. Actually, Medurinum is better in the evening. Then Lycopodium and Calcarea carbonica are also 2 possibilities because of the panics. But Calcarea carb is a chilly person and she is so hot. And also both Calcarea carb and Lycopodium have strong fear of ghosts. And she enjoys movies on horror movies and evil spirits. So these were my thoughts. And now I want to ask you, what is peculiar in this case? Because then we will find, you see, this is what I said. Depending on the symptoms we insert, the VC is going to suggest a remedy. But the knowledge of the symptoms to be inserted is determined by the knowledge of theory. This is why you see Professor Vithoulkas says that theory is the most important, most important. So coming back to the understanding from the point of view of theory, what is most peculiar in this case?
We have an answer: aggravation after sunset is peculiar. Selvarsley writes.
Yes. It is peculiar. It makes you think of few remedies, but that's not the answer that I'm looking for. Self-harm, yes. This is peculiar, self-harm, which she does. Hiding. Yeah, thank you. Hiding. Now, this is why she goes under the table. And this is peculiar. And I asked her, why you do so? And look at the answer. I hide under the table so that no one comes near me or sees me. So, is it a fear of being observed of Calcarea carbonica? Or now, you see, she says that I want to hide under the table so no one comes near me or sees me. Now, are there any suggestions? Aconite? Aconite? Still aconite? Okay, I will go further. Let's not think about the remedy right now. Please tell me, what is the mistake in this repertorization? Then we will all reach to the remedy. Please don't think about the remedy now. Please tell me what according to you, because this is what I said in the beginning, that what we are inserting, feeding into the repertorization. So Dr. Anil says too much rubrics. No, that's not the problem. No. There is a mistake in this repertorization. What is that mistake? Can you tell me, please? Grading? Some are common symptoms? No. No, no, no. Many third underline? Okay. Nobody has given me. Yes, somebody said just now, Dr. Altaf, combination of chronic and panic attack symptoms. This is absolutely the correct answer. We have put together the chronic symptoms and the acute symptoms. And if we are considering the fright, there is a possibility that a layer has come up. And first we have to prescribe that and then go deeper into the case. So let me try to show you what Dr. Altaf and what I think this case should look like. And this is the mistake. And you see why theory is so important. So on your screen, just see what I am trying to show now. Now Can you understand the remedy? If the case looks like this and not how I showed in the beginning, you see, everybody can see the remedy. Arnica.
Arnica.
Because it is a mistake, because you see, all 3+ symptoms were chronic symptoms. She gets manhandled and she starts hiding because of fear of being approached. Don't come near me. Don't touch me. This is an arnica layer. And this is how you have to look at this case. What makes you look at this case is because of understanding of theory. Otherwise, we will combine everything. So let me take you back to the compass. And compass gives us this possibility. So if we go back to the same repertorization, and compass says we can copy this analysis into a new, and we do that. And now we start deleting the chronic symptoms. So we keep anguish and fear, we keep hide, we keep ailments from fright, we keep this fear behind. Mood changeable, we take away, delete. Irresolution, we delete. Warm aggravates was always there, so we delete. Obesity, we delete. Fear of men, we keep. Fear in the evening, we keep. Fear dark, we keep. Fear of death, we keep. Fear crowd, we keep. Tendency to reproach, we delete. Suicidal disposition and thoughts, this was there even before, we delete. Mutilating is still there, we keep this. Aversion to company is still there. The dreams have come after, so we still keep them. Weeping before menses, we take away because they were chronic symptoms. The premenstrual pains, we take away. Generalities of cravings and aversions, we take away. Sleep position, we delete. And desire fat, we delete. So we delete the chronic symptoms. And into this totality, we will add one symptom because we understood that fear of being approached, which we know has arnica strong. So we will add this into 3 times into this repertorization. And now let us solve the case. You see how arnica comes up. Second remedy, which was not there even in the first 10. And if we just add one more symptom, fear of touch, 3 times, and it will even defeat aconite and come as the first remedy. So what I'm trying to share, my friends, when the patient comes to us, he presents a plethora of symptoms. Many of them would be underlined 3 times, but we have to segregate them. We have to understand what is recent, what is past, chronic. Is it the same picture? Because theoretically, there is a possibility that after the fright, she might have stayed in the same remedy which she needed before. This is possible. But the fear of being approached, touched, and hiding under the table is so strong that it should make us think only of arnica. So you see, arnica covers 7 symptoms out of 15, though aconite also covers 7 symptoms out of 15. But arnica becomes first. Stramonium, 5 symptoms. But as I said, for to be stramonium, the fear of dark should be very strong. 4. Okay. So let me take you back to the presentation. So Professor Vithoulkas in Arnica from Viva, he writes, the main theme of arnica symptomatology revolves around a deep traumatic experience upon the physical or emotional or mental body. A traumatic experience of the human organism resulting from injuries, falls, which we all knew before he gave us this picture, concussions, but also fright and fear. So, injury, trauma on any level should make us think of arnica, especially when, if this experience leaves the person with a tremendous fear of coming into physical contact with anything which is hard or penetrating. So that is why they say, don't touch me. Bruises, worse, touch. The whole of the symptomatology develops around this basic fear. Do not touch me. Do not come too close to me. You see, this is why when I heard that she hides under the table, just imagine why somebody would do that. Because nobody should come. Otherwise, aconite will not do this. And most of all, do not penetrate me physically or metamorphically. And this is why arnica, together with phosphorus, has the biggest fear of coercion. Don't enter into me. This is the fear of the women. Even we find creosotum there, but that is because of the local acridity of the female genitalia. But arnica and phosphorus, because of this tremendous fear of penetration. So the traumatic experience in arnica is such that the person is left with a feeling of having been wounded deeply and of the affected parts being so sensitive after the wounding that the idea of somebody touching them is unbearable. So don't touch me. Even after an emotional trauma, arnica is the remedy. Okay. So we gave her arnica 10 mg, 1 dose in the month of April. Follow up. 24 days after arnica, her panics are better because she did not get the severe panic. After arnica, did not get a single episode where she had to hide under a table from fear of being approached. So this did not come. You see, she was still, because when she came to us, she was on the allopathic medicines, which had lowered the intensity, but she was still getting these crises periodically. But after arnica, none. Frightening dreams are better. No dreams of injury in this time. You see, how beautiful is this? We say arnica is a remedy for injury, and she was getting these dreams that she was getting injured. And now these dreams have stopped. No dreams of injury. This means we have touched the subconscious. Still has fear of men and rape. Fear of dark is slight better. Rest all was same, no change. So prescription is of course placebo, but what we can do now, we can advise her to taper the allopathic medications. 2 months after arnica, she came to us and she said, I have been drinking coffee, and she has had coffee multiple times since the last follow-up. Though we tell to each and every patient of ours, we give them in written also, don't drink coffee. But she did this, no problem. No panics of hiding under the table since the last follow-up, but something has changed, and that is the sadness and the crying has increased. Her mood swings are still very strong, underlined 3 times. She is getting periods of emotional breakdown where she cries, and this urge to inflict self pain. In these breakdowns, she cries and again she digs her nails into her skin to the point, as I said before, bleeding. Thoughts of jumping down, that she must jump from the first floor, or hurting herself by a knife. She gets these thoughts when she is in this state. She still feels better with animals and she can drink milk so as to rule out Athusa. Still fear of men, but she wants her windows closed, no problem from them. And she wants to be alone. Still fear of dark, underlined 2 times, which had reduced slightly and still not further change in it. Then she tells me, which her mother confirms, started watching more horror movies. I feel the need, I give it to you, this information in quotes. I feel the need to see these movies. Demons scare me, but they also interest me. The idea of possession, which means being possessed by the devil, and blood excites me. So this is where we were 2 months after arnica. No panic, emotional breakdowns with crying, and what I described to you on the screen, this has increased. What would we like to do? I open the chat again. So Anna writes stramonium. Anna, for stramonium, again, the fear of dark should be strong. Mercy says to wait. Waiting was a possibility. Somebody says to repeat, Mona Lisa, to repeat arnica. Anacardium. You see, anacardium has 2 essences. Why I am not even thinking of anacardium? One is severe lack of self-confidence, and one is severe cruelty. She has irresolution, but she does not say that I have lost my self-confidence. And she does not say that I feel cruel. She has love for animals. So anacardium is the remedy which I am not thinking. I am thinking of a remedy, and I asked a question to her. Can you tell me which question did I ask? After hearing this information. So the question I asked is behind the red box.
Insanity.
Insanity. Insanity. Yes. This is the question I asked. Correct, Anne? Correct, Sanket? Because as few people are thinking, I was also thinking of the same remedy. And I asked about insanity. She did not tell her by herself till now. But when I understood about this remedy and I asked her, and then she confirmed that she has this fear very strong, that I'm going to go crazy. She did not give this information voluntarily. You see, there are some remedies which, if we look into fear of insanity, we find their Mancinella, we find their Calcarea carbonica, pulsatilla, cannabis indica. Some of them will give this information voluntarily, but she did not give me. Okay.
Yes.
Okay. So fear of insanity confirmed this remedy. Now let us go to VC again. No, not December 10th. Sorry. This was the today. So 13th July, you can see we take fear of insanity, which, as I said, is strong in cannabis indica, Mancinella, Calcarea carp, pulsatilla, simicifuga. Mood changeable. This both is pulsatilla. The interesting rubric that we have to take is thoughts persistent of evil. Evil. Lachesis, Mancinella, strychnine. Now look at this rubric. Mutilating his body. Look, Mancinella is there. Love for animals. We know Ethusa, yes. Fear of men. Fear of dark. If you will see, Mancinella is there. And suicidal thoughts is a big rubric. I took it in 2. So let me show you the results. The first remedy is Mancinella. Because pulsatilla, cannabis indica will have fear of insanity, but they will not have this idea of evil, the idea of self-hurting, which is present in Mancinella. So Mancinella covers 5 out of 8 symptoms: fear of insanity, thoughts of evil, also suicidal thoughts in 1. This is interesting. And fear of dark, we said. So let us go back to the PowerPoint. So what does what information we get from Professor Vithoulkas. In the e-learning, which I said is a boon for all of us, he describes, look at his experience. He says, Mancinella, I found, is indicated mostly in women. So there is some affinity which some women get attracted towards the evil part, and they reach to Mancinella state. And in individuals that are weak in will, with a weak willpower and also weak intellect, because they cannot reject these thoughts. They are fascinated by the evil, the devil, the horror, the vampires, the exorcist, the evil deaths, all horror movies, which many of us cannot even go and look, even an image of that. So then Professor Vithoulkas writes, such state will come after shocks which have this element inside. Example, after seeing a horror movie, a person who is Mancinella can start the problem after seeing something which has to do with evil forces. So they are attracted towards these topics, and the fright may deepen this state where they further go to the deeper pathology of Mancinella. If some of you know it, delusion being possessed by evil, Mancinella is strong, which this patient did not have. Also, you will see a great fear that something bad is going to happen to her. Something bad which is indescribable. You see, indescribable. They cannot put words to it, which eventually, over a period of time, crystallizes in the idea that I am going crazy. So they cannot put words to this fear since the beginning. It's an indescribable feeling that maybe I am losing control, I am losing my mind, and if you ask them directly, they will confirm that I am going crazy. Now, this is interesting. You see what Professor Vithoulkas teaches us. He says we can sometimes confuse Mancinella with pulsatilla, as Mancinella is also a hot remedy towards warm side, and she can also cry a lot and are timid people like pulsatilla. So we can make this mistake as all of us were thinking. And Mancinella weeps out of self-pity because of their inner state. But look at the essence. Why this attraction for evil? This we won't find in pulsatilla. Why this intention of self-harm, digging nails? You see how, if you see, they show evil with long nails, digging nails into the skin and blood coming out. She had the same idea. She was digging her nails into her skin. So because she was still on allopathic drugs, we prescribed Mancinella 200 once a day for 6 days. Now somebody may ask me, and before they ask me, I will put this question. I gave 10 mg before and 200 now. Why? Somebody says allopathy, which she was taking even before. Yeah. So Sumera is correct because that was a superficial layer, a recent symptomatology. For example, somebody comes to us with a flu and with a clear picture of bryonia. And even if they have osteoarthritis, rheumatoid arthritis with deformed joints, the bryonia is an acute layer. With a clear picture, we can give them bryonia high because it's not going to affect the joints. It's going to take away the flu. But once we prescribe the chronic remedy for their joints, we will decide upon the depth of the pathology because now we are going deep into the organism. So Mancinella here is a chronic prescription for her, is a deep prescription because we are aware of this state, which, her mother told me that she watched a horror movie, the first horror movie, when she was 11 years old. Can you imagine? A girl of 11 watching a horror movie and having no fear. So from this, we understand that from that age, she had this predisposition and she needed Mancinella. So now we are going deep. This is why, and she's taking allopathy, that is for 6 days. Okay. 1 month after Mancinella, episodes of crying reduced, urge to hurt herself has also reduced. This is interesting. The mother said she is interacting more with people and friends. This is what we want in every case. You see, she had become in herself, now she is opening up. Another interesting phenomena. Just 5 days after Mancinella, which is from 18th June, she stopped enjoying and watching horror movies. So something in her clicked, changed, and the fascination, the frequency of watching them reduced. This is a deep change. Fear of insanity and dark are both better. Fear of men is still the same. So, of course, the prescription is placebo, and we ask her to taper down the allopathic drugs further. So, okay, now, yes, I must answer this question because I know, Bernardo, what you say is correct, that the potency is determined by level of health. Higher the level of health, we can give high potencies. The lower the level of health, we should give low. And also, in mental cases, we can give even high potencies up to 1M if the patient belongs to group C, if it's purely a mental case. Now, in this case, one problem was that she is taking allopathic drugs. So I cannot give her high potency daily. That is one. And the second is, because we are to differentiate it from arnica, as I said, arnica, I was sure that it is only a superficial and is not going to be affected by the allopathy because it's going to take away the layer. Now here, since there is allopathy, since the child appears to be deeply sick, I decided to give, because I wanted to repeat. So for repetition, the safest was 200 potency. This is why I chose 200 and not high. Okay. So 3 months 10 days after Mancinella, panics absent, suicidal thoughts and self-harm are also absent, fear of insanity and dark both absent, fear of men slight better, fear of someone after me slight better. Now she tells me no fascination for movies on possession. But now I am watching movies on serial killers, on homicides. So you see how the fascination is changing. If you reflect upon this, how there is still that dark element now, but not of the same depth of evil and mm, and devils, but coming to more, still there is darkness, but she enjoys this blood serial killers. Okay. So 1 month ago, 3 out of the 4 allopathic drugs have been stopped completely. Presently taking an antidepressant 10 milligram on alternate days. Before it was 20 milligrams daily. So the tapering is continuing. 3 drugs have been stopped, and the one which was 20 milligrams daily when we met her in April, now she is on 10 milligrams on alternate days. New changes. Her anger has increased. She sometimes gets dreams of stools. Headaches have increased, which are worse sun, light, and noise. What do we do now? Wait. Somebody writes aloe. I don't know. Maybe they want to write something else. Headaches. You see, first of all, we must wait because the pathology that we are treating is anger is nothing in front of that. Anger is too little a thing from where we are bringing her out, from the world of blackness, darkness, demons. You see, from anger is too little a thing. We cannot make a mistake and say, oh, she is going into belladonna and we give belladonna because headache, sun, anger. No, nothing doing. We wait. Forget everything. No problem. So prescription wait and continue to taper the antidepressant. Now, this is her last follow-up, 5.5 months after Mancinella, a recent follow-up. Since 30th September, she has stopped allopathy completely. All the drugs are stopped. She has even stopped watching movies on serial killers now. You see, the organism needs time for the inner darkness to go away. Let the remedy do. Let the remedy help. Don't disturb it. I did not prescribe anything. And by herself, she has stopped watching movies on serial killers. Now, I mentioned something in quotes now. You see, this is the beauty of homeopathy. She says, before bloodshed and evil would excite me more. Now, good and positive part excite me. Now, I like the part if a villain shows humanity. You see how the goodness is coming slowly. Before it was, she wanted to see blood. More the blood, more the possession. It was, somebody's mic is on, please. So before, more the blood, more the evil, more it would be an excitement for her. And quoting her again, she says, now my interest has shifted to reality TV. So this is amazing. Very happy. Sadness is better by 90%. Feeling that no one likes her is absent. I have made friends and I am going out more. You see how the light takes away the darkness. This is all I can say, and this is the light in our lives, homeopathy. Episodes of overeating and feeling guilty are absent. How everything comes into order. Irresolution is also better. We did not prescribe anacardium. We did not prescribe Baraita carb. So everything, panics, suicidal thoughts, weeping, frightening dreams, fear of dark, of insanity, someone after her, all are absent now after Mancinella. New change, she says, I desire cold milk, underlined 2 times, and my feet are getting cold in the evening, underlined 2 times. What do we do now? Wait. Yes, nothing. Absolutely correct, Sumera. So, prescription was placebo. Now, coming to what we learn, because the learning is the most important. Every case teaches us. So, arnica was prescribed on the strategy of causation and a keynote. There was a clear causation, fright, trauma, and a keynote, fear of being approached. Our mistake was that we were trying to prescribe on the strategy of totality, which was not possible in this case. So, first remedy was arnica on the strategy of causation. Mancinella was prescribed purely on the strategy of essence, the essence of evilness, darkness, self-mutilation. It does not cover all the symptoms. It cannot. We don't know that picture. But it was essence of Mancinella. So those who have done e-learning will understand what the gift of Professor Vithoulkas. Okay. Another thing what I want to say here we saw an early stage of Mancinella and not the late stage where they feel that they are possessed by a devil. You see, the beginning is this fascination, and slowly the fear of insanity, and then they feel that they are taken over by the devil, and then the fear of insanity further increases. So this was missing in this case because this was not so deep. Okay. Of course, as I say, she will still need more remedies. We have not solved this case completely. Now, because I said she was towards the obesity, and because this cold feet is coming, and she may need Calcarea carbonica. If later on she becomes chillier, then we may think of Calcarea carb. So, you see, when symptomatology of a superficial layer intermingles with symptomatology of a deeper layer and creates confusion. This is what we saw in this case. This was the confusion. The difficulty was that after the stress of fright, now please be very careful here. You see, if after the fright, she would have said, let's say, after the fright, she would have developed a pathology of severe palpitation, of any other pathology, any physical pathology. We could have differentiated. Our problem was we got confused because she was suffering from panics even before, since 2017, as I said, and that pathology intensified after this fright. So this is why we got confused. But the differentiating point was that this present panic had a different color, had a different remedy picture, which made us think of arnica. Because of the new symptom, fear of being approached. So this is why I say that knowledge of theory is so important, and I cannot thank Professor Vithoulkas enough, because he is the one who has made such issues so crystal clear that we can reach to the correct remedy so logically. And we understand what we are doing, why we are doing. So knowledge of theory, my friends, is very important to discriminate information. Only then the compass will help us to find the right remedy. And with this, I want to thank my teacher first for sharing his wisdom with us, and all of you to be present here and to participate in this session. Thank you so much.
Thank
And
you
now,
so much, dear Adul, for this excellent, marvelous case of panic attacks in this young girl with
thank you.
with arnica and then the Mancinella. So arnica is not only for bruises, as you quoted excellently for the Materia Medica Viva description, is for also metaphorically for injuries in the mental and the emotional body. Excellent case.
Thank you, Lefteris. Thank you.
You have answered, I think, almost all the questions. I think we have a few questions that we have to see. One question is if there was an aggravation either from any remedy. No aggravation.
No, I was not told, even though I asked, there was no aggravation.
No aggravation. Okay. Other question is if the self-harm is a symptom of arnica.
I cannot say that. I don't know, Lefteris.
Okay, and the Sumera writes about this habit that she had to press the nails on the skin. She writes that many therapists recommend the strategy of pressing a comb or nails on the skin in cases of anxiety or panic attacks. Maybe that's why she was doing it, but I don't think so. It was not because someone told her.
Because she also had suicidal thoughts, fear of jumping and of killing herself with a knife. So she had this tendency to harm herself. Yes.
Great. I think that's it. Thanks again. Thank you very
Dr.
much.
Thank you.
And of course, we thank our professor, George Vithoulkas, for giving us this possibility, this knowledge, to be
Absolutely.
able
Absolutely.
to do these things. Okay, so thank you very much. And I pass the microphone to Andreas Tsokanas of VC team to show you some offer that we have and close the session.
Hello, everyone from me. I hope you can hear me.
Yes, very good.
That is?
Yes, yes.
Okay. First of all, I would like to thank Dr. Atul and Dr. Latika for this great presentation. Dr. Atul, he presented that for a wonderful presentation as always. Dr. Lefteris Tapakis, who has been always there for us and giving us all his help for this great result. And I would like to just to mention that Vithoulkas Compass and the support team and the VC team will always be there for you. That is, if we go to the next slide,
Yes.
if you would like, if you use Vithoulkas Compass or if you are new to Vithoulkas Compass, you can schedule and you need some help, you can schedule a personalized presentation, and we can go through and show you how to use all the features of Vithoulkas Compass platform. And also, if you would like if you have any questions or any difficulties, or if you need some help of renewing or purchasing Vithoulkas Compass, you can always send us an email to support@vithoulkascompass.com or myself, Tsokanas@vithoulkas.com. We will always try to come back to you ASAP. And finally, if you would like to renew or if you would like to purchase Vithoulkas Compass for the first time, we can offer you a 20% discount by using this coupon code for 6 or 12 months subscription. So if you need any help with that as well of how to do that, we can help you with that by sending us an email to support or to me. So anything you would like, we will be there for you. Finally, I would like to thank all of you for being being here for us and for this great presentation. So thank you, everyone, and thank you for attending to this webinar.
Thank you, Andreas. Thank you, Lefteris. See you later.
Thank you. Thank you.
Bye-bye.
Bye-bye. Bye-bye.